Hello and welcome to my video presentation on disopyramide. My student ID number is U3234402. Hope you all enjoy. Disopyramide belongs to class 1A antiarrhythmic drugs and it is used to treat certain types of arrhythmias, especially the ventricular tachyarrhythmia, which is a life-threatening condition. It is also used to treat hypertrophic cardiomyopathy when beta blockers are ineffective. Thereby, it stabilizes the irregular heartbeat by affecting the electrical activity of the cardiac muscle cell. There are two types of capsule formulations based on their drug properties: immediate release and extended release disopyramide. In immediate release, drugs are released rapidly and require a higher initial dose, whereas in extended release, drugs are released slowly and no initial or maintenance doses are required. Disopyramide is usually administered orally in the form of capsule or tablets. It is absorbed mostly in the gastrointestinal tract, especially in the small intestine, and the drug is taken up to the bloodstream. After 2 to 6 hours of ingestion, the maximum plasma concentration is achieved. The onset of disopyramide ranges from 0.5 to 3 hours and the patient is expecting to have a therapeutic effect at this range. However, some of the factors that influence absorption are administration routes like intravenous, oral, and intramuscular. Disopyramide is metabolized in the liver by an enzyme called cytochrome enzyme. The CYP2D6 enzyme plays a significant role in metabolizing disopyramide into mono and delcalide. During the metabolism phases, disopyramide is metabolized into many metabolites, and mono and delcalide is a major metabolic of disopyramide, which has less pharmacological activity than the parent drug. In the distribution phase, drugs are widely distributed throughout the body, can be found in various tissues and bind with proteins by about 50 to 60%. Disopyramide also has the capacity to penetrate the blood-brain barrier and enter the cerebrospinal fluid that surrounds the spinal cord and brain. Lastly, the therapeutic range is 2 to 4 mg per liter, and this dosage range is regarded as beneficial for regulating irregular cardiac beats while minimizing toxicity risks. In the elimination phase, roughly half of it is eliminated by the urine by the kidneys as an unchanged drug, approximately 10% is eliminated as metabolites, and 20% is removed as a mono and delcalide disulfide. During the repolarization of the cardiac action potential, the sodium channels in the cardiac muscle cells are blocked by disopyramide, resulting in decrease in influx of sodium ions. It helps to slow down the heart's electrical signal, thereby making the heart to beat slow, especially the lower chambers of the heart ventricles to beat slow and steady. Due to increased rate of depolarization, speed of the electrical impulses or action potential traveling along the cardiac muscle cell is reduced and thereby prolonging the action potential, particularly in the lower chamber of the heart ventricles. Some of the therapeutic benefits of prolonging the action potential by disopyramide are restoring the normal heartbeat and preventing re-entry circuit, stabilizing the electrical activity. When action potential duration is prolonged in cardiac cells, the total refractory state is prolonged, which include both depolarization and repolarization phase. When the repolarization phase is prolonged and cell spans in these states are extended, disopyramide can assist to avoid responding to abnormal electrical impulses. It will help to reduce rapid irregular heart rhythm and stabilize the electrical activity of cardiac muscle cells. Disopyramide also has a negative ionotropic and anticholinergic effects. Disopyramide is scheduled for prescription medicine only, therefore pharmacists must dispense only prescribed medicines. The prescribers are medical doctor, cardiologist, general practitioner, and nurse practitioner. When using disopyramide, some of the precautionary measures to be considered like patient on digoxin, patients on flecainide, pregnancy and breastfeeding, cardiomyopathy, hepatic and renal impairment, and some of the contraindications like hypersensitivity to the drug or its component, second or third degree AV block without pacemaker, overt heart failure, and long QT syndrome. Some of the common side effects of disopyramides are prominent anticholinergic side effect, dry mouth, blurred vision, glaucoma, palpitation, Constipation, urinary retention, adverse side effect may worsen arrhythmic. How to take disopyramides? Take disopyramide dosage and timing exactly as advised by the doctor or prescriber. Follow direction label on the prescription. Swallow extended release medicine with a glass of water. Do not crush or chew. Take missed doses as soon as you remember. May skip if your next dose is near. Maintain regular follow-up checkups and cardiac tests as directed by your healthcare professional. Report any unusual side effect. Do not stop taking this medicine suddenly unless your doctor tells you to. To reduce stomach upset, take with or immediately after food. Avoid grapefruit and grape juice.